Basal layer.
Basal layer of the, more important is of the basal layer of the
epithelium.
Excellent. That's situated in the basal layer of the.
Can we shift the working area in the center of the screen? You are doing depigmentation in second quadrant, right?
Yes.
You can shift the patient away from you slightly.
Okay, just a second. थोड़ा सा इधर tilt करेंगे. इस तरफ. थोड़ा सा नीचे को ले लीजिए. नहीं पूरा नीचे मत जाइए. थोड़ा सा रहेगा. Let's stop. Now.
Better now. Center here.
Okay. So, what were we saying? We were discussing something. Yeah. So, it is the melanocytes are basically present in your basal layer of the epithelium. Okay. So, what we are going to do is we are going to strip away that epithelium that has those melanocytes. Now, something we have to be very careful while we do this DP procedure is that we have to make sure we are in the epithelial layer only. Okay, maybe probably a very light layer of the connective tissue.
Video is gone. Maybe the camera has moved.
Okay. We try to get it back. Now?
No, ma'am. Yes, ma'am.
We're just working on it. Give us some time. Okay?
Yes, ma'am.
So it's displaying now?
Yes, ma'am.
So what I was saying was we have to be careful while we doing the procedure that we do not have to touch the bone. We do not have to denude till the bone because we already know that the melanocytes are present up till the basal layer only. So we are going to go only as deep as the epithelium, probably one small layer of the connective tissue. That's all, not more than that. And again, we have to be careful that we should, some of the melanocytes are also present, the most troublesome melanocytes are present at the tip of the IDP. See, for example, you can see here also. But always it is advised not to touch the area because the tip of the IDP is very, very delicate. And we do not want to cause any kind of a recession to the patient. Okay? So we are going to stay away from that. The margins, two things you have to always stay away from. Your marginal gingiva and your tip of the IDP. Now one thing, before I started the procedure, I asked the patient to smile. Okay? And why do we ask the patient to smile? Anyone please?
The amount of gingival visibility when it's
Excellent. The amount of gingival display. We are checking for the amount of gingival display. So, if in some patients, the patient has a very wide smile. Okay, they have a premolar to molar, or you say that molar to molar smile. So, in this patient, it's hardly canine to canine. So, that's where your depig is needed. Another thing, when you're doing scalpel depig, most of the time what happens is your scalpel, see here, it's hardly working now. So it gets blunted. I need to change it. Just give me some time, I'll just change it. 2 minutes. Harendra ji, आप आराम से है ना? हाँ. Just 2 minutes.
Ma'am, you are scraping away the epithelium.
Yes. And when we do a scalpel method, we usually scrape away the epithelium. We do not peel it away. Stripping. There's two methods. One could be stripping, one could be scraping. So we prefer the scraping. Why? Because when you're scraping, you have control over your blade. Okay? But while you strip, gingiva has different thickness at different areas. So if you're stripping it away, okay, while you're slicing, if I were to say, if you're going to slice it away, if you lose control, you might end up removing more than what you want to. Okay. So right now, what I'm following is a scraping method. So see here, hardly there is any pigmentation. I will not go to unnecessary instrument. Is there a energy? 2 minutes. So this is a scraping method. The most, reliable method is your scraping method. And always remember, whenever you do any of the perioplastic surgeries, you're always going to keep changing your blades because they tend to lose the efficacy after some amount of time. So you are unnecessarily just scraping away with a blunt instrument. So better is to do it with keep changing the blades and keep repeating it. So he had very mild pigmentation to start with. Another thing, patient is a smoker, so very important. Patient has to be informed that post-op. What is it? Post-op. Nobody? Can someone step up and say what is the most important instruction I'm going to give to this patient? If he is a smoker, if he is giving me a history of smoking, I think interns have slept. Prashansa ma'am? Hello? Sure. Hello? Hello?
Yes, ma'am.
Oh, I'm so sorry. I was going on talking without realizing I had put my mic on off. Sorry about that. But my video was on, right?
Yes, ma'am. And we had a great discussion with Prashansa, ma'am.
Okay, that's good. Actually, I forgot that my mic was on off. Forgot about that. So I was saying this patient is a smoker. This patient has given me a history of smoking, okay, which may predispose to him having this
Gingival pigmentation.
pigmentation. Okay. So what is the most important post-op instruction I'm going to give to this patient?
Do not smoke.
Excellent. Don't smoke after surgery. Another thing, I do not take up the patient. The patient has already told me that he has. Remember, no matter how much the patient is ready to pay you, do not touch such patients. Because then what's matter how much the patient is ready to pay you, do not touch such patients. Because then what's going to happen is the patient is, if a patient cannot stop smoking for 2 weeks prior to the surgery, there is no way that the patient is going to abstain from smoking after your surgery. So that if the patient happens to do that, it's going to lead to necrosis. So it will do more bad, more harm than good. Okay. So you have to be very careful with that while taking history from your smoker patient. So this patient has confirmed and he does not have any halitosis of smoke. So we decided to proceed with it. But again, as I said, the consent is very important. Consent for such patients is very important. Okay. Is it visible to you?
Yes, ma'am.
Okay. A little more remaining. Probably I'll change blade again once more. Anushka, can I have another blade, please? Till then, you give me that one. I'll work with that till you change it. हरिंदर जी आराम से हैं? Almost done. Okay. Again here. Where is that pigmentation? Do not unnecessarily strip away the epithelium that does not have any pigments. For this area, I am very great change probably. So there are other methods also of deeping. This is just a scandal method, but you will be surprised to know this is a very small, simple, sweet method which is still the gold standard. Always remember, gold standard means nothing can beat that. So that is the topmost procedure. So the gold standard for depigmentation is still scalpel depigmentation. So there are different methods. You could even do it with burrs. So we have a PG in our department who's doing her research on that. She's working with a CeraBurr. So a CeraBurr is going to remove the pigments, okay, through your abrasion, your epithelial abrasion. You can do it by burr method also. You can do it by scalpel method. Okay. The laser method you will be seeing in the afternoon. Probably if we have enough patients, we will get our hands on that also. Okay. In the afternoon, you will be seeing the laser detail. You could also do it with chemical agents actually. Even some chemical agents, they help you peel the outer epithelial layer. But can anyone tell me what could be the disadvantage of chemical peeling? For example, vitamin C or anything. Any chemical peels for depigmentation, what could be the disadvantage?
And when we can even handle the tissues we do not desire to take it.
Definitely. What the exact terminology is, we do not have control over the penetration. Okay. So like in a scalpel, I know where I'm working, I know what I want to do, but in your chemical peels, you do not have control over your chemical. Okay. So how much is the depth of penetration? You have no control over that. And secondly, what happens is in chemical peels, most of the times there is a lot of color change, so you are not able to appreciate how much of your defect have you attained. So in those cases, no, you will have to call the patient back for next appointment because you cannot overdo it. So for such patients, जितना हो गया, you will.
Ma'am, a video चला गया है. Can you adjust the camera?
Yeah, sure. Is it okay now? So I have a very cooperative patient, Mr. Harinder ji. Very cooperative. And more of his cooperation I require in post op. ठीक है हरिंदर जी, ज़्यादा आपका cooperation मुझे तब चाहिए कि आप स्मोकिंग बिल्कुल छोड़ देंगे और आगे करेंगे भी, ठीक है? तभी आपकी ये पिन गम्स लास्ट करेंगे, वरना फिर मेलोसाइट्स ट्रिगर होंगे तो वापस हो जाए. Is the video on now?
Yes, ma'am.
Okay. So we'll just see if this patient is able to stay back. He agrees. Then he has थोड़ा सा इस तरफ करना. He has pigmentation here also. Probably laser you can do it on this. Okay, so I leave this for laser so that about you can just have a demo of laser on this part. Okay. So in scalpel, you have an option of either putting a surgical dressing or not. It's up to patient's comfort. So right now, if I see there is not much of bleeding, there is enough amount of hemostasis that is attained. So I would rather not place a pack over there. Just advise the patient, give the patient proper post-op instructions and proper medication, and that should do it. Scraping method, you're just going on scraping the epithelium till you feel the pigmentation is still remaining. Remember not to go too deep. Stop when you start seeing the raw connective tissue surface. Okay? Raw bleeding connective tissue surface tells you that the epithelium is gone. Another way to know if the epithelium is gone is obviously the colored pigments go away, and another thing is that the shiny. See, if I were to okay, आप पूरा करना चाहेंगे? So what happened? Just give me a second. See, if I were to show you a non-treated area, can you see that shine?
Now it is not visible. It is out of the field of view.
Okay. Now, इस तरह थोड़ा सा रेंज इस तरह हो जाइए. Now, can you see this area? It is shining. The epithelium has a particular shine. Can you see that? It reflects light. But when you see here, you know there is no reflection of light. That means the epithelium is stripped away. Can you see that?
Yes, ma'am.
So we'll just speak to the patient if he is willing to stay.
Excuse me, ma'am.
Yes.
Ma'am, can you repeat the last point again? You were not able to appreciate the shiny surface.
Okay. इस तरह turn करेंगे जी और इसी में रह जाएगी. Can you see this area? Can you see the mandible? Can you appreciate the mandible here where I'm pointing?
Yes, ma'am.
Now can you see that shiny surface? It's reflecting light. Can you see that?
Yes, ma'am.
Okay. Can you see here? That is the connective tissue because it is not reflecting the light. Can you see that scraped away epithelium here?
Yes, ma'am.
So that's how you know that you are safely there. Okay. So we are going to speak to the patient. Meanwhile, if the patient is not too busy and he can wait, so that you can see similar in the lower, you can see the laser tipping. Okay. And in fact, you can do hands-on class. Alright. So we'll just have a word with the patient. If he is okay to wait, just give me a minute. I'll just confirm that, get it confirmed in the OPD. Give me a minute, okay? Arindiji? आराम से है ना? लेते हैं। रेंज आप थोड़ा सा रुक पाएंगे लेजर के लिए? ठीक। हेलो प्रशंसा मैम। हेलो।
Yes, ma'am.
Ma'am, the patient is agreeing to wait for the afternoon slot also. So hopefully
Okay.
these students can have a look at the laser debate also. Luckily.
Right, ma'am.
So we'll just give him some analgesic, make him wait so that the lower can be done by laser. They can appreciate the difference and they can even have a small hands-on if possible.
Like postment in the hands on the patient.
Yes.
By laser.
See, what we are thinking is right now, if I'm left with some more time, then I'll call you in batches downstairs to show you the microscope, so that post lunch I divide you into batches. We are going to divide you into batches, and few of you will stay with me here, do the partial thickness flat banana exercise with me here, and few of you can be in the laser room and do the hands-on with the laser. All right, this is our plan. So if they can have a this thing like laser painting, so they can see. No, laser to any procedure they can see. So in batches, one batch can see the different, one batch can see this thing. Predictive. Patient is ready to wait till the afternoon if they want.
And can we ask in the OPD how many laser cases are there?
Yes, sure, sure.
Because on one laser patient we will have maximum 4 to 5 students.
This patient is indicated for phrenectomy also. So I think one batch can see the phrenectomy, one batch can, 2 or 3 batches can see do the lower. Yes, yes, definitely. So likewise, we can just segregate few patients so that jinka microscope to all of you students, all of you have to do this exercise, okay? The microscopic partial thickness raising of the flag. So meanwhile, whosoever is free from the last numbers, those people can go to the laser room and do the needful.
Now, let's do this thing. First, 15 roll numbers will be there with you in the microscopic room to see the parts of the microscope. And the last roll number, I will call the 8 student. First 4 for the interpretation and next 4 for the predictive.
Sure, that will also work out. That will be great.
Okay.
Sure. That will be great because the patient is anesthetized also. So then it will be good only that if this anesthesia only we can work on.
Yes, ma'am.
That will be ethical also actually.
We will not have to wait.
Definitely. So, Prashanta ma'am, shall I delay the banana exercise or I'll finish the banana exercise? It'll hardly take me 5 or 10 minutes.
You want to give demo for the banana exercise?
Yeah, because individually I'll not be able to do that. We'll have less time, no? Each of these have to do.
Then ma'am, let's go into the demonstration
Right?
for the banana and then we'll
Yes, definitely. So, just give me a minute till I just wrap up the patient. Anushka,
banana exercise for partial thickness flap using microscope. Here, scaling, then minor surgery, that was depigmentation with banana. And next we will be showing you the surgical part.
क्या बोल रही थी मुझे? हाँ, why not? हाँ, ठीक है. But then send somebody else here. I'll finish the banana exercise. I'll also go. हाँ. हरिंदर जी थोड़ी देर आप बाहर बैठ जाएंगे. अभी आपको जाना नहीं है, ठीक है? क्योंकि हमें आपको दवाइयाँ वगैरह भी लिख के देंगे. Do one thing. अनुष्का इनको एक बार वेटिंग एरिया में. Thank you हरिंदर जी.
ठीक है, थैंक यू.
हाँ, आपको ये